Hello, this is a virtual microscopy slide from a case of purulent pericarditis or infective pericarditis. And first, let's orientate ourselves at low magnification. Here is the deep aspect of the myocardium, and this whole area here is the epicardium, which is composed mostly of fat, adipose tissue, and blood vessels. And here is the surface of the epicardium or the visceral pericardium, where we can see a very thick layer of acute inflammatory exudates. Let's have a very quick recap of normal histology. This histology atlas is taken from Pathweb, our free online pathology resource, and you can find the link in the video description. Registration is free. So here is a picture showing the epicardium, which is this layer comprising adipose tissue. And on the surface of the epicardium, there is a thin mesothelial layer that lines this, and this is what we see normally. However, in the case of pericarditis, as we see here, instead of a thin layer of mesothelium, there is a thick layer of fibrino-purulent exudates. Let's return to the virtual microscopy slide. And here in this virtual microscopy slide, we are focusing on this area, which shows the acute inflammatory purulent exudate within the pericardial sac. So this inflammatory exudate is composed predominantly of neutrophils. We can see the multi-lobed nuclei of the neutrophils. Many of these are still viable or alive, and some of them show degenerative changes. And we can also see in some areas necrotic cellular debris, as you see here, this bluish basophilic material. So we have necrotic cellular material, we have numerous neutrophils, and we also have this pink network of fibrinous material or fibrin. Sometimes we can also see bacterial organisms, which we do not see in this current specimen. So this purulent exudate is composed of neutrophils, fibrin, and necrotic cellular debris. Let's learn a bit more about purulent pericarditis. This is an infection of the pericardial space with pus or purulent material within the pericardial space with a high neutrophil count, as we saw, and usually the causative organisms are bacterial in nature. This can be due to a complication of infection in the vicinity, for example, pneumococcal pneumonia or infective endocarditis. It can also be due to trauma to the chest or thoracic surgery, and this can particularly be seen in immunocompromised patients, for example, HIV patients or patients who are receiving chemotherapy. And grossly, we would see these yellowish-green, thick exudates. In other words, we will see pus in the pericardial sac. This virtual pathology specimen and picture is taken from, again, Pathweb, our free online pathology resource. And you can also compare and contrast this with a different case of fibrinous pericarditis, which shows more fibrinous exudates rather than dense neutrophilic infiltrates. So just to summarize the microscopic features, we can see these purulent exudates within the pericardial sac and coating the surface of the visceral pericardium, composed of a very heavy neutrophilic component as well as fibrin and necrotic cellular debris. Here is a higher magnification picture where we can see the neutrophils, and here admixed with fibrin. And this is just to compare this with fibrinous pericarditis, which is usually due to non-infective causes, for example, autoimmune disease or post-myocardial infarction, where we would see a more dense fibrinous exudate, which is less cellular compared to purulent pericarditis. In summary, here is a virtual microscopy slide of purulent or infective pericarditis, where we can see this thick layer of pus or purulent exudates overlying the visceral pericardium, composed of numerous neutrophils or acute inflammatory cells admixed with strands of fibrin as well as necrotic cellular debris. And the cause of this is usually bacterial, and the treatment is drainage with systemic antibiotics. Thank you.